My name is Elizabeth Gigliotti, and I'm one of the Living Donor Transplant Coordinators at Mass General. These are the Mass General selection criteria for live kidney donors. These general selection criteria are specific to Mass General, though many of them are used at transplant centers across the country. All living donors must be at least 18 years old, and any non-directed donors, or donors who do not have a specific kidney recipient in mind, must be at least 25 years old. All donors must be donating voluntarily and not be feeling pressured or coerced into their decision. Donors should be in good overall physical and mental health, including being free from diabetes, which is the leading cause of kidney disease, having a BMI or body mass index of 35 or less at the time of evaluation, and ideally a BMI of 32 or less by the time of donation surgery, having no active drug or alcohol abuse or no significant history of drug or alcohol abuse, having no significant medical conditions such as heart, lung, or liver diseases, bleeding or clotting disorders, recent cancer, though skin cancers other than melanoma are usually acceptable, but most other types of cancer will require years of remission, being free from HIV, active hepatitis B and C, or other infections or behaviors that increase the risk of developing these infections, having no significant psychiatric conditions requiring significant treatment or at higher risk of recurrence, having either current or a history of kidney stones or high blood pressure will require additional testing to determine whether the donor is acceptable or ruled out, being willing to stop all forms of smoking for at least 8 weeks prior to donation surgery, and stop any oral contraceptive pills and usually hormone replacement therapy for 4 weeks prior to and after donation surgery. For direct donation, where the donor donates their kidney directly to their intended recipient, the first item we consider is blood type. There are 4 blood types: O, A, B, and AB. Donors who are blood type O are considered the universal donor and can donate to a recipient with any blood type. Donors with blood type A can donate to recipients with blood type A or AB. Donors with blood type B can donate to recipients with blood types B or AB. Donors with blood type AB can only donate to recipients who also have blood type AB. Most of the time when people find out their blood type, they also get a positive or negative at the end, which is the Rh type. This marker is found on red blood cells, but not on kidney cells. For this reason, the Rh type does not matter for kidney donation. The second major item we consider when determining if a potential donor is compatible with their intended recipient is to see if the recipient has HLA antibodies against the donor. HLA stands for human leukocyte antigens, and these are the markers on the outside of everyone's cells that tell the body which cells are their own and shouldn't be attacked, versus foreign cells like a bacteria or virus that should be attacked. Many recipients do not have any HLA antibodies. The usual way that patients develop these antibodies are through prior transplants, pregnancies, blood transfusions, or on very rare occasions, infections. There are a few tests that are performed to determine HLA compatibility. For the recipient, the testing involves seeing if the recipient has antibodies against any HLA antigens. The donor is tested to see what HLA antigens they have on their cells. The tissue typing lab can then compare the results to see if the recipient has antibodies specific to the donor's antigens. If it appears that the recipient does have these donor-specific antibodies, a cross-match may be performed, where the recipient and donor blood samples are mixed to see if the recipient's serum destroys the donor cells. If the cross-match is positive, meaning that the cells are destroyed, the donor would not be able to donate directly to their recipient, as the recipient would reject the donor's kidney. Even if the cross-match is initially negative, or if the recipient does not have any antibodies, a cross-match will be performed 1 to 2 weeks prior to the donation and transplant surgery date, just to minimize the chance that there are any newly developed antibodies that could cause immediate rejection of the donor kidney. If the recipient and donor are found to be incompatible, either due to blood type or donor-specific antibody, there are 2 options available. The first option is for the donor and recipient to be entered into the Kidney Paired Donation, or KPD program. In this situation, the donor would donate to a compatible recipient, and the recipient at Mass General would receive a kidney from a compatible live donor as part of a swap. The picture here illustrates the simplest form of paired exchange, where pair 1 and pair 2 are incompatible, so donor 1 donates to recipient 2, and donor 2 donates to recipient 1. This simple swap is relatively rare, and more often swaps involve multiple pairs of donors and recipients. There is a separate video available that provides more information about the KPD process. The second option for incompatible pairs is desensitization. The goal of desensitization is to remove donor-specific antibodies from the recipient's blood. However, the process is not possible for some recipients, involves giving the recipient medications and filtering their blood over a period of time, and has a higher risk of rejection, so desensitization is now rarely performed. The first phase of the living donor evaluation process starts by the donor candidate completing the online health questionnaire. Once the questionnaire is successfully completed and submitted, the candidate should be taken to a website confirming their submission and should also receive a confirmation email. The donor team will reach out to donor candidates with information to start the evaluation process, including the phone number to set up a Mass General medical record number if the patient doesn't have one already, and a variety of educational materials, including a link to this video. If there are any questions or concerns about the educational materials, the donor should reach out to the donor team for clarification. The donor candidate will need to sign 2 forms, one which says they reviewed and understand the information included in the educational materials and video, and another which allows the donor team to obtain medical records from their primary doctors for review. The information the donor team is looking for from primary doctors consists of a physical exam, including height and weight, blood pressure, and medical and surgical history, and any age-appropriate cancer screening tests, such as colonoscopy, mammogram, or Pap results. If needed, the donor team may test the donor candidate's blood type or tissue typing to see if the donor and recipient are compatible. Once the records and results are reviewed, the donor candidate will be given information about blood and urine testing, including a 24-hour urine collection. Depending on the donor candidate's medical or family history, additional tests may be ordered. For instance, if there is a strong family history of diabetes, the donor candidate will likely need to undergo a glucose tolerance test to make sure their own risk of diabetes is low. For Phase 2, if the PCP records and lab results look good, the donor then comes to Mass General to meet with the team. The day starts with a recap of the education class, then meetings with one of the nurse coordinators, the social worker, and the nephrologist or kidney doctor. In some cases, an appointment with the psychiatrist may also be scheduled. After the education class, the donor will sign a few forms, including a review of the informed consent that was previously signed. If any labs need to be repeated or additional labs are ordered, these will be drawn while at Mass General. An EKG and a chest X-ray will be performed to check for basic heart and lung health. One of the forms the donor signs while at Mass General is an increased risk behavior screening. The U.S. Public Health Service has defined behaviors which put donors at an increased risk of transmitting infectious diseases such as HIV and hepatitis to the transplant recipient. Anyone who answers yes to participating in one or more of these behaviors in the past 12 months is considered increased risk. A man who has had sex with another man, anyone with a history of injectable, non-medical drug use, anyone who has received human-derived clotting factor concentrates to treat a clotting disorder, anyone who has had sex in exchange for money or drugs, anyone who has had sex with somebody who has had sex in exchange for money or drugs, anyone exposed to known or suspected HIV, and anyone who has been in jail for at least 72 hours. If a donor answers yes to one of these behaviors, it does not mean they are ruled out for donation. The recipient is told that the donor is considered increased risk, but the recipient is not told which of these behaviors the donor answered yes to. If all of the appointments and testing completed on the first day look good, the donor comes back to Mass General for a second day of appointments and testing. The donor gets a CT scan of their abdomen to look at the anatomy of the kidneys, including the size of each kidney, the arteries and veins going in and out of the kidney, and any abnormalities such as stones or cysts. The donor then meets with one of our donor surgeons who will review the CT scan and determine which kidney looks best for donation. The donor will also meet with the ILDA at this visit. If any additional appointments with providers such as the psychiatrist or infectious disease doctor are required, these can often be scheduled on this day. Finally, we may be able to coordinate any cardiac testing such as a stress test for this day, if this testing is required. For Phase 3, once these appointments and all testing are complete, the donor's information is brought to the Multidisciplinary Selection Committee meeting, where the results are presented to the transplant team. One of 3 decisions will be reached about the donor's candidacy. The potential donor can be approved, at which point we will start the process of determining a potential surgery date, or entering the donor and recipient pair into the paired exchange program if needed. The potential donor can be deferred if additional information or testing is required before a candidacy decision can be reached. Once this information is obtained, the donor's case would be presented again at the selection committee meeting. The potential donor can be rejected if the committee feels that the donor is too high risk to proceed with living donation. Any donor candidates who are rejected at Mass General are welcome to approach another transplant center that may have different donor selection criteria. The donor team will share the committee's decision with the donor candidate, and an official letter will be provided. If the donor candidate is approved, the donor and recipient teams will determine a viable date for surgery. Once that date is set, the donor candidate will receive information regarding the pre-operative testing and appointments, which take place 1 to 2 weeks prior to the scheduled donation date at Mass General. The approved donor meets with the coordinator for preoperative education, as well as meeting with their donor surgeon to review the most recent SRTR data and to sign the surgical consent form. The potential donor will also receive a phone call from a member of the preoperative anesthesia team to review his or her medical and surgical history. All scheduled donors must stop any oral contraceptive pills and usually hormone replacement therapy for 4 weeks prior to the donation date, and must stop all forms of smoking for at least 8 weeks prior to the donation date.